so folks can access the information later. We know these are busy and chaotic times. Closed captioning is available, and you will not be on recording unless your audio video won't be shared unless you're speaking. So just know that if that is something you want to avoid. We are happy you all are here. We love to see faces if that feels appropriate and you want to turn on your cameras, but we also understand there's a plethora of reasons why one might stay off camera, and so we respect and appreciate that as well. We've got a really fantastic agenda. We've got a little bit of something for everybody. We are going to hear from our colleagues over at the Washington Department of Commerce around a budget proviso around understanding trauma experiences for providers. We have our fantastic colleagues from public health to give a little COVID 101 refresher and some time to answer questions. Team Child is going to be here later to talk about youth and Miranda rights and a new law that's going into effect in just a couple days. And then we've got really exciting news with our legislative process that's well underway here in the state. So that's what we've got going on. I would love to invite someone to read our mission, vision, and values statement, and we'll throw that up on the screen for folks. So if we have a courageous volunteer, please jump in.
Good morning, everyone. This is Laura with Bellevue Livespring. Can you all hear me?
Yes, welcome.
Awesome. I wasn't sure. So do I read all three of them or one of them?
Go for all three, just because we'll get going here. Thank you.
Yeah, perfect. So the mission is we mobilize our community to challenge systemic causes of homelessness and advocate for housing justice. Our vision is a region that acts on a shared sense of responsibility to ensure that everyone has a home. And our values are equity, justice, and collective action.
Thank you, very appreciated. And again, just, feel free to introduce yourselves to each other in the chat as we go along. We are working hard to create agendas that allow for time at the end for kind of an open forum, member sharing. We're not there yet. We always have a lot of information we want to share with you, and we want to pack these agendas so you get as much as you possibly can in this hour and a half that we spend together. So know that's something we're working towards. We think it's an important part of our community building and our information sharing. So that is, just know that's something we're working towards. I do have one update, and then I'm going to turn it over to Allison before we jump into our agenda and our first presenter. But there is an opportunity to serve on the Gathering Collaborative for King County's Racism is a Public Health Crisis initiative. So this is a group of community members that are going to take part in a community designed and led process to equitably spend $25 million of federal funds. So we will throw more of that information into the chat with some links. There's a flyer, and then this will absolutely go out in our follow-up notes and be on our blog. So just know that that is something we did want to share out so everyone had an awareness of that. But on that note, I'm gonna hand it to our fearless leader, Allison, to kick us off.
Thank you, Jody, and good morning, everyone. I am, of course, really happy to see folks here, and I will say it is exactly 2 years since the coalition hosted our first general membership meeting on Zoom, because in January 2020, there was a snowstorm. And as many people know, snowstorms are a big deal in this region. So we experimented with this thing called Zoom, and we had no idea that we were shortly going to become experts, although some of us, myself included, are still at the beginner stage of Zoom expertise. So I just want to remark that, you know, we were worried when we switched to an online format that we would lose what we have when we gather in person together: the coffee, the mixture of sweet and healthy treats, the ability to run into folks whom we haven't seen for a long time, catch up on who's working where, what kind of interesting things folks are up to, welcoming new faces. And yet I'm constantly impressed that we've managed more or less to keep some of that going, even though we are virtual and physically separated. So just another reminder to each of you, including those who have joined us virtually but never had the opportunity to join us in person. We do still have a contract for a physical rental space, and we hope someday to be gathering in person again. But we're really grateful to those of you who are willing and able to share your video. We don't care what your hair looks like. We are happy when your family members and pets make a screen appearance, and we really do want this to be something that attempts to replicate the sense of community that is part of what the coalition exists to create and support. So with that said, I also want to note that these are open public meetings, and back in the day when we were meeting in person every month, we welcomed anyone and everyone, including folks who were coming in to get warm and get a cup of coffee and not sure what the meeting was, as well as reporters. So I know we've got at least one reporter on the call today. We really do welcome folks who are covering these issues to join us, but I do want to remind anybody from the media who's here today that we ask you to please not use anybody's quote who is not a presenter without checking with that person first. Although these are public meetings, they are pretty special meetings, and we are trying to protect this as a space where service providers, advocates, people who have personal experience of homelessness and housing instability can speak freely and not necessarily go on the record if they don't feel that they want to. So with that said, I will turn to the portion of the agenda that's mine this morning, which is the great pleasure of introducing Kathy Kennard with the State Department of Commerce. Hi there, Kathy.
Hi.
And I want to just note that a lot of the work that we do in Seattle and King County is funded through state and federal money that comes through the Department of Commerce. Why, you might ask, is housing and homelessness housed in the Department of Commerce? Well, that is a really good question that we should dig into at some point. But that is, in fact, the State Department where, at this point, enormous amounts of state and federal funds, much of it one time related to the COVID-19 pandemic, but a lot of it ongoing, related to funding sources that we have all fought hard for in the state legislative process, originates. And there are a lot of people, including Kathy, behind the scenes most of the time, who really are extraordinary partners, who take in information from folks who are doing the work and try to honor the intent of lawmakers who are passing budgets, and merge those two things together into good services, physical construction of buildings and operations that really are the crucial scale-up point for our collective work to bring to life the vision that that our colleague just shared out loud. So one of the things that sometimes happens in the budget process is that we advocate not only for bills that are going to become laws, but for pieces of the budget that are in the form of provisos. And I think many of you may know and have personal experience of the extraordinary traumatic hardships that are sadly part of doing this work, both primary and secondary trauma that have been exacerbated, as so many things, through the pandemic, but that existed before the pandemic. And one of the things that happened a little over a year ago was the loss of a longtime coalition member and friend, Chris Benson, who was a regular at coalition membership meetings, who always took notes and brought them back to her coworkers at Plymouth Housing, and who now has a beautiful permanent supportive housing building named in her honor in the Lower Queen Anne neighborhood in Seattle. We mourn Chris's life being lost tragically and far too early, and we celebrate her as, in many ways, the consummate social worker, funny, non-traditional, and a fierce advocate with and for the folks whom she worked with. And that loss and many other hardships really inspired us to work with Representative Nicole Macri to create a budget proviso to say we need to understand and document what homeless service and housing workers are experiencing across the state as part of educating ourselves and the state legislature to fund things differently and respond appropriately to the nature of this work, which is, as we all know, essential, but not always treated that way. So with that, I want to welcome warmly Kathy to share with us what happens once you get something like that written into the budget and approved, and it goes to the hands of capable state public servants like Kathy, so that we can really start to understand the whole process and participate in what comes next. So welcome, Kathy, and thank you for joining us.
Thank you. Can you hear me okay?
Yes, we can.
Perfect. Thank you again. And thank you for that introduction, Allison. And good morning, everyone. So Kathy Kennard, she, her pronouns. I've worked at the Department of Commerce for 20 years. It's been the only state agency I've worked in and probably will retire from, and have been working in homeless housing for 18 of the 20 years. So I only know homeless housing in Commerce, Allison. I don't know it any place else. And of course, have been a big fan of this group's work for a while. I'm on your distribution list. I get all of the action alerts and emails, and everything you're doing is so important. And I'm a fangirl for sure. Jody, can I share my screen? And
yeah, I think I just have to make you a co-host.
That's great. I just have two little items I want to share, and Allison just went over some of it, but I wanted to just familiarize you with the actual. Can you see the screen with the actual bill? Yes. Okay, cool. So I just wanted to familiarize it. So there was a bill 5092 that passed last session. We're in a current session, but this was last session. And it provided $250,000 for this study. This is significant funding for a study and recommendations. And it was, as Allison said, to help us identify what we can do, these interventions we can do for the trauma that's experienced by staff. And the proviso specifically called out that they want a report submitted to the legislature by June of 23 with all of this information. It also talks about the fact that they want surveys and interviews and small group conversations. So it was pretty comprehensive in terms of, where they wanted to get the information from. So this all passed, and by last July of 21, we have information now to go forth and do a proviso. We were a little bit pressed for time and resources in our work as we managed the eviction rent assistance programs, but we were able to get out an RFP, a request for proposals. It went out across the country, anyone in Washington state and across the country who would be eligible to do this study on behalf of Washington state. We had 11 entities submit proposals. We had a pretty significant review team of folks looking at and examining who they were, their qualifications, how they would go about doing this work, what was their project plan and strategies for getting it done. It was a pretty significant competition, and there were several that rose to the top pretty readily. But the review committee picked BDS Planning and Urban Design. BDS stands for Brian Davis Scott. It's the name of the principal for this organization. They're local. They're in Seattle. You might be familiar with them. But Brian Davis Scott submitted a pretty a really well done proposal. They have staff who have worked in homeless housing services and mental health services and project planning, people who know how to conduct surveys and focus groups and interviews. So there are our entity that's going to work on this for the next 18 months with us. We just had a launch with them about their next steps, but they're working on their absolute project plan. Like, how is this all going to get done by the time their report is due? They're working to identify those study questions. Those are going to be really important, how they're asked, and identifying the people to ask them from. So we have shared all of our lists, and they will continue to build out those lists of people to interview, to give surveys to meet for focus groups. And there is going to be an incentive plan for participation in this as well. They're also putting together an advisory committee to make sure they stay on track and have subject matter expertise when thinking about those questions around trauma and the experiences of trauma, when thinking about the design and accessibility of even participating in this survey. So that's going to be it's an important part for us too, that it isn't just for people who can take a survey on a computer or meet on the phone. What are all the ways of accessibility that we need to be considered? So in just about a year, they'll submit a draft of that report to us. And we will get back to them, and they'll submit their final draft by April 15th. So even though it's not due till June, we want time to work with it and to workshop it even additionally outside of what their project plan may include. So that's the work they're going to do and the structure they're going to work around. They're also really willing to come and talk to any of you or talk to this coalition at any time and provide updates. They have a pretty significant project team that will be able to answer questions. We'll have information on our website about what's happening. Most importantly, we just want to make sure they have the biggest distribution list possible to access all of the possible responses to the questions they develop. So we've given them everything we have. If there's something the coalition has available, I'm happy to pass it on or connect you directly to the project planner. But yeah, that's what I wanted to share. I'm hoping that starts to demystify a little bit more about the proviso and the steps we're taking at Commerce. Are there questions I can answer?
Thank you so much, Kathy. I think I'll just suggest that you stop screen sharing, because sometimes people are more likely to be able to ask questions or think about things when they can see each other. And I really appreciate your going into some detail about the process that you went through and the process that we can expect. We certainly deeply appreciate that there's urgency to this. And maybe while people are thinking about questions, you could just briefly remind folks of the biennial budget process and the reason why we're here in 2022. This happened in 2021, and the report won't be done until 2023.
Yeah, sometimes I feel like that civics lesson we could all go back and learn again and again. Yes, so it was last session, and then the session ended, and then the biennial budget began in July 21. So that's when I then had the ability to take this funding and develop a competitive process. And yes, this money is for 2 years. So July to June, June 23. So July 21 to June 23. And there's 125,000 each fiscal year. Significant funding is going for just the the salaries of the staff to do the study and to conduct the interviews. And there's a significant amount of money in there too for the participation, the incentive funds for participating in the study.
Thank you so much. And we really appreciate the care that you and your colleagues took in developing this. And I hope it's okay to say, you know, because we at the coalition, we weren't the only ones who helped develop the proviso language with Representative Macri. We certainly reached out to others in other parts of the state as well. But we really did want to ensure there were things like recognition of the difficulty even of making sure that this is going to reach all corners of the state, people with a variety of levels of access to electronic media, and that people should be compensated for their time to participate in these kinds of research projects, but also that this isn't something to sit on the shelf. This is really intended to inform next steps. And so I really appreciate that there's the opportunity to speak with the folks as they're designing this process and to involve all of the people on this call and their colleagues in making sure that it gets us somewhere useful. I think that the experiences of trauma have not really been talked about very much in the nature of this work for a wide range of reasons. And the more that we lean into wanting to make sure that people with a variety of lived experiences are also hired and paid in staff positions at agencies, the more we really need to be direct and honest with what that effect has on people's well-being and their ability to do work well with people who are also experiencing a lot of trauma. So while it is a heavy topic, we're really grateful and excited to see that there's some attention being brought to it. And I just want to say, I think, you know, I'm not seeing questions or people raising their hands, which is completely fine. This is the first iteration of just sharing that this is happening, and we'll have other opportunities, including some listening sessions that we're going to host that may contribute information to this process.
Great. Thank you so much for inviting me, and I will be available for updates as the process goes forward.
Wonderful. Thank you so much, Kathy, for your work and for your partnership. We know it is not a cushy job to be working at the pace that you and your colleagues are working, and we're really grateful that you took the time to join us in person this morning, virtually in person.
Thank you so much. Have a good rest of your day. Thank you.
You too. Thank you very much.
Thanks, Kathy. So we are moving on to our next part of the agenda, which is our lovely public health colleagues. They're going to be doing a little presentation. So we have Erica Fardig, whose voice you may know and well recognize from the Wednesday provider meetings. She is always a wealth of information around any number of things COVID related, but she has been leading the testing team for forever, I think, in her long public health career. And there is her beautiful, lovely face. Welcome, Erica. Ida Belfosse is also here with us today. She is the Community Partnership and Racial Equity Manager over at Healthcare for the Homeless Public Health. She leads those Wednesday provider meetings. Erica and Ida Bell being here with us today is part of the partnership that the Coalition and Public Health HCHN have really strengthened over the course of the past 2 years. I mean, there's always been a long, strong relationship, but we've really snuggled in together the past 2 years. And part of what we've heard from our members and the senior leaders is that a refresher around COVID kind of 101 and those strategies that help keep us a little safer just could be really useful right now. There's a lot going on. Folks are overwhelmed, overworked, overburdened, and sometimes those messages get missed, or the repetition is really helpful to hear those things. Over Omicron, absolutely over Omicron. So bringing more opportunities for more folks to hear directly from public health, if they haven't had that chance yet, was part of this partnership. And we've got more things kind of coming down the pike as we hear more from you all and what you need, and as we just sort of like, you know, put some offerings out to see how we can continue to support you through really, really hard and trying times in the best way that we know how. So we're always open to that feedback. But as part of that partnership, we have Erica. She has been a public health nurse for a very long time. She is now a nursing supervisor over at Public Health. She's got about 6 slides to kind of go over, and then there should be some time for question and answer. And actually, within each section, we'll kind of pause and see if there's questions around the particular resource and tool that Erica is presenting on. So I believe one of my colleagues has Erica's slides to share. Wonderful, Erica.
There we go. Okay.
Wonderful, Allison. Erica, please take it away, and thanks for being here.
Sure, thanks for inviting us. Can you hear me okay? Great. So this is going to be a very high-level overview. We're just going to touch on several topics briefly. At the end of each section, please ask questions. We'll do our best to clarify. This is not meant to be a comprehensive, but more of just a refresh. But we know there's been a lot of changes, a lot of science that we've learned over the last 2 years, which also means that there have been new guidelines, new recommendations, new things to change practice, and that can be a lot to keep in your head or keep up on. Next slide, please. So this is the portion that's most near and dear to my heart. I have been with the public health mobile COVID testing team since April of 2020. We've seen a lot of changes in that time. And one of the big things is that you are now starting to hear and see and maybe even experience these rapid antigen tests. So I wanted to go over all the different types of tests that are currently available and just some key points about each of those. So the main one is we're now starting to do at Public Health, and you probably have seen it out in the community. You can purchase them at pharmacies if you can find them. We know it's very difficult. There's also the brand new through the US Post Office service where you can sign up and get free tests for per household if you have a home address to mail those to you. So rapid antigen tests, what are they? They are designed to give a in the moment picture of your infectiousness to others. That's the best way that I can describe it. So they are really good if you have a high viral load in your nose where we collect a sample. And they are less sensitive than the standard PCR tests, the ones that you would have to go to a facility and have the sample collected and have it run through a lab, which can take quite a number of days sometimes to get results, especially right now when sites are overwhelmed with that. There are a number of brands out there. I think there are 13 that have emergency use authorization. So there's nothing that is official right now, but they all have emergency use if they're on one of these 13 brands. Most common ones that we are seeing right now are things like Buy Next Now, although that's hard to get, iHealth, FlowFlex, Quidel, QuickView. There's a whole bunch out there. And they're designed so that they're easy to use, so that you can read the package insert, follow the instructions. Most of the time they have good pictorial instructions, and oftentimes the package inserts come in multiple languages. It's usually English and Spanish right now. So these tests are not as good if you're very early in your infection and you don't have a high viral load in your nose or where we're testing right now. They also basically, if you think of a curve of a virus in your nose, as you get exposed over here, and it's a little bit flat, takes a while for that to start replicating to a high level in your body. Then when you kind of go up to the peak and come back down, that's where the rapid antigen tests are going to come up as positive. And then moving on to the PCR tests, they'll be good in that really early parts. Still takes a little while before you get enough virus to pick up on a PCR, but then there's this very long tail afterwards for some folks. So PCR tests can continue to be positive for some individuals up to 90 days after their initial positive test. So they're much less useful in determining when somebody can be safe to be around others. They're really good at determining for sure, did you have COVID virus in your body at some point in the last 90 days? And they can confirm a rapid antigen test, although most of the time positive on a rapid antigen test is a true positive. PCR tests, you do have to use a laboratory. They are much more expensive, tends to be about $100, $150 sometimes to run a PCR test. And the turnaround time can take several days. So if you have somebody who's infectious, they could continue to be around others and not know it until that result comes back. The last type of test we haven't heard so much about lately, and those are antibody tests. Those are not tests that determine if you currently have COVID infection. Those are really determining your body's immune response if you've had a previous infection, or there are some specialized ones that are occasionally used to determine if you've had a robust immune response to a vaccine. Questions on those tests?
Thanks, Erica. Well, while folks are maybe processing some of that information, oh, I see a hand. Karina, take it away.
Thank you. I've been seeing a lot of people with really clear symptoms like loss of taste and smell and still testing negative on the antigen. Is there a higher false negative on the antigen? Do you know what the percentage there is?
I don't know what the percentage is. I know especially with more like with Delta, loss of taste and smell is actually not a common symptom of Delta infection. It's also a symptom of other types of viral infections, common colds and other things. So it's possible, even though the person is testing negative, they might not have COVID, they might have another respiratory illness. The antigen tests are best when they're done in sequence, meaning 2 tests 24 hours apart, if you don't have a known exposure to somebody who's COVID positive.
Thanks for that. Karina, did that answer your question, and any follow-up for there?
Yeah, that's good. Thank you.
Thanks.
Sure.
Good
question.
And it also ended up answering one of my questions about the using it in cereal to increase the accuracy. Dua Rahima, I see your hand. Go ahead.
Yeah, so my question is, I know we talk about a lot about the testing, but I want to know more about the impact afterwards in the recovery process, and what should somebody do once they had COVID, and what happens after that? Because we don't talk about that a lot.
Yeah, try to give the 30-second summary of this one, and please chime in if this isn't answering your question fully. If somebody has a positive result, especially on a rapid antigen, but also on a PCR, we want that person to isolate away from others for a prescribed period of time. So that depends on how they're feeling, how long we would recommend. If somebody, and it also depends on their vaccine status. So if somebody is fully vaccinated and they are not feeling symptoms at all, but they have a positive test because they were part of a workplace or environmental reason, or they just were curious and maybe they tested before going to see a friend who's vulnerable, we would recommend that person to isolate away from others for 5 days. And if they monitor themselves for symptoms, if they're still asymptomatic, nothing happening, we would recommend they wear a really high quality mask around others for an additional 5 days. But after that portion of time, 10 days from the original test, they're kind of free to go about their normal activities. If somebody is symptomatic, we base things based on how they're feeling and especially how their symptoms are doing. So if somebody starts to develop symptoms 5 days after their positive test, we would encourage them to continue to isolate until it's been at least 24 hours since they've had a fever with no fever reducing medications, and also that the rest of their symptoms are improving. So for most people, that would be another few days. If you want to be extra cautious, that would be 10 days fully that you're isolating from others, so long as things are improving.
Okay, so another question to follow up on that one. So like once somebody, they went through all that. So I've been told different things like I guess the different strains, you can catch it again or you can't catch it again. I have seen people who have had COVID multiple times. And then once you do have COVID, do you had it and you tested positive, do you go take a test? And how long, if you take a test, does it still show positive? Because if people have to have a negative test going back to work or whatever, and you're still supposed to, it was said that you still test positive for up to 90 days, how does that work?
Yeah, that's why the official CDC recommendations do not recommend a test to return to work policy, especially if we're using a PCR test, because some people will continue to test positive because it's such a sensitive test. It's picking up proteins of the virus, and it cannot determine between a live infectious virus versus just those viral protein bits that aren't contagious or infectious to others. So remind me the first half of your question. I apologize.
Thank you. What about the folks that keep getting COVID?
Oh, keep getting COVID. Yes, great question. Yes, thank you. Yeah, so unfortunately, getting one variant or one strain of COVID doesn't necessarily protect you from getting another strain. We've seen that for people who have had previous Delta infection, that might not fully protect them against getting COVID from the Omicron variant. And it just has to do with the mutations of the virus, the body's immune response. The best protection we still have is vaccines and vaccination. And the protection is really against getting severe illness and being hospitalized, and also protects against mortality as well. But just like we have many strains of common cold out there and many strains of flu, so getting an infection with one doesn't necessarily convey protection to others. It's also possible, we've seen people who have had repeat infections with the same variant. It seems like for some folks that protection lasts about 90 days, and then the body no longer has the same robust response to a new exposure, and you may be reinfected.
Great, Erica, that is just incredible amounts of information explained really well. For the sake of time, I'm going to have us move on, and we can continue to throw questions into the chat, and we can make sure we get all that to you all after the meeting.
Great. So the other thing you probably heard in the news recently is that CDC updated their guidance around mask use, specifically around what type of masks they would recommend in different situations. And we all remember from the very beginning where the CDC just didn't have quite enough data to recommend mask wearing at all. And then they changed their mind and said, okay, yes, we think that would provide a layer of protection, use cloth masks. Because they really wanted to protect the supply of the high level N95 respirators that were in incredibly short supply at that time for folks who were in the medical setting and dealing with people who were known COVID positive, and try to protect that workforce. Now that we have a much more robust supply throughout the country, we've changed the guidance again. So the recommendation is really to wear the best quality mask that you can get to protect yourself right now. So for most people, that will mean either a KN95 respirator that does not require fit testing, but generally has very high levels of filtration, and when it's worn correctly can provide nearly identical protection as an N95 respirator. And then for other folks, it's also a disposable surgical style mask that has a specific type of material in the mask. It's usually multiple layers, usually 3, and it provides much better, higher quality filtration than a cloth mask, which is often fairly porous. So we don't necessarily recommend layering these one on top of another, but use the highest quality mask that you can safely wear for yourself. And obviously, if you have respiratory issues, you're on oxygen or other things, there may be considerations around which type of mask is most appropriate for you. Questions on masks?
Oh, Shauna, go for it.
So one of the things my staff does is they do cloth masks, but with filters in them. Where would that be in this?
I would say it would be between the disposable mask and the cloth mask. Depends on the type of filter that's used.
So if it's less effective, even though it's a cloth mask with a filter, it's less effective than just the plain disposable surgical mask.
It really depends on the material of that filter and the fit of the mask. So if the material of the filter is something called heat blown polypropylene, then that's the same type of material that is used in some of those disposable surgical masks. That gives it's not only how porous the surface is, but there's actually like an electrostatic charge to it that essentially attracts particles to stick on the mask instead of going through the mask into your mouth or nose. So it's a combination of 2 things. But if you have a really tight seal, like a really well-fitting cloth mask with that type of filter in it, that would probably be at least as good as a disposable mask that's much looser around the edges.
Okay, thank you.
Yep.
Thanks. And Ellen, I see your hand. Go for it.
Yeah, just a quick question. Public Health distributed some of those KN90s. Are they're just maybe 5% difference than the 95s? Is that what that means?
Yep. Yeah. The idea is that you're filtering 90% versus 95% of particles. So not quite as good, but still much, much better than a cloth mask.
Awesome. Thank you.
And you'll also see occasionally a KF94. Oftentimes those are a different style. Frequently I've seen them for children's sizes, and they're almost equivalent to the KN95s, 1% off.
Thanks, Erica. And I will have us move on, but I might flag as a follow-up to offline, as I know the RHA hosted a meeting last week, and the question and need for pediatric good masks came up. So that might be something that we can connect both with them and you, and make sure that folks have the resources that they need for masks for the tiny folks. All right.
Yep. Or for small people like me who don't fit adult size masks. The next slide I want to talk about is, which one do we want to do? Vaccine types or environmental?
Sorry, that was my error. I clicked twice.
Okay.
Vaccine types is your next slide.
Great. Vaccines, we're hearing a lot about vaccines, a lot about boosters. I'm not going to go over this in very much detail. Everyone knows that there are 2 mRNA vaccines that are authorized for use in the United States right now, the Pfizer and the Moderna. Pfizer is still the only one that is authorized for ages 5 and above. It's possible that they will get authorization for under 5 in the next couple of months. We're all hopeful that that may happen. But right now it's just Pfizer for 5 and above and Moderna for 18 and older. Both of these are given as 2-dose series, approximately 3 to 4 weeks apart. And then the new recommendation is that for 12 and above for Pfizer, a booster shot 5 months after you complete your primary series. And that booster shot can be either Pfizer or Moderna. The same thing, they just updated for Moderna, a booster shot for 18 years and older, 5 months after completing your initial series. And again, it can be either Pfizer or Moderna, your choice. Last, there is the viral vector vaccine that is currently the Johnson & Johnson or Janssen brand in the United States. Primary series is just a single dose, but because we're starting to see that it has less effectiveness against Delta and possibly Omicron, and just in general against COVID, that's no longer the recommended vaccine unless it's one of the others is unavailable or unacceptable, logistically complicated, or there's another compelling reason like an allergy to a component in an mRNA vaccine that would make it a more appropriate choice for someone to receive. If you do get a J&J vaccine, they would recommend a booster 2 months later. And the preference would be for a booster of one of the mRNA vaccines versus another Johnson & Johnson. Questions on vaccines?
I am not seeing any, but if they come up, throw them into the chat and we can kind of move on to environmental controls.
Great. So the other thing that you probably heard a lot about is improving our airflow, specifically improving ventilation. And there are a lot of different things that you can do to make this happen. But the idea is that the more you have fresh air coming into an indoor environment, or the more that you can be in an outdoor environment, the more likely you'll have that airflow disperse any potentially infectious particles from somebody that you may be around, or if you are yourself infected, that you would be less likely to transmit the virus to somebody else if you have much better air ventilation, airflow. So one of the easiest things that we can do that doesn't require anything is open windows. Harder to do in the wintertime, I understand, but especially if you're doing any kind of indoor testing, or you're around somebody who is known to be COVID positive, if you can open a window as well as wear your mask and other things, that can help considerably. You can also use a portable fan facing so that it's blowing the air out the window as opposed to into the room, and use that to improve air circulation in an indoor space. If you have an HVAC system, making sure that you have a high quality filter in it, that it's correctly installed and maintained. And there's different ratings on how fine particles get trapped in those filters. So that you're looking for a filter that has a MERV 13 rating on it. The other option is portable air filtration devices. Those are plugged into rooms. You want to make sure that you're putting them in a space that is as close as possible to where people might be talking. So if they're on the floor, they'll be less effective than they're up on a table. If most people are seated at a table or talking, standing up. Also, you want to make sure that there's at least 12 inches all the way around that filter. So it's really filtering air appropriately, as opposed to backed up completely against a wall. It will be much less effective. We have a whole team at Public Health that's an environmental health team that is happy to go out to sites or do a virtual consultation if you need help with options for improving ventilation in indoor spaces. There's also an interactive tool on the CDC website, kind of designed for people to get ideas about how to improve ventilation in home spaces. And there's a link on here and you can play around with that. The other thing that we think about in terms of environmental controls is also just that 6 foot of distance still. trying to make sure that we are spacing people out, limiting crowd sizes. We want to be especially cautious about maintaining distance when people are taking masks off to eat or to sleep or to do other activities. And then the more that you can socialize with folks not in your household or in your daily social circles outside, the lower your risk will be if somebody is infected of transmitting to somebody else. And then again, I know we're a broken record, but high quality, well-fitting masks are also part of these environmental controls. Questions on these?
I'm not seeing anything, Erica. Thank you.
I think people have heard this message over and over again. The same is true, even now.
The repetition is good and important.
And then the last thing, I fully realize I have yanked this off the internet, so credit should be at the bottom of this page. Just wanted to remind everyone that no one measure is going to be the be all end all for helping protect against COVID. We really need to have this multi-layered approach to trying to reduce risks as much as possible. So everything that we've talked about, distancing, ventilation, masks, vaccines, the combination of all of those things is going to be our best bet in reducing transmission. And so it's been known to be called the Swiss cheese model. And I like this one because it actually uses Swiss cheese in the image. But the idea is that we need to try to use all of the tools in our tool bucket right now to help us get through this stage of the pandemic and those to come. And that's it. That's all I've got. I'm happy to take questions if we have some time still.
We do, and I see Ann Allen's got her hand up, so please take the floor.
Oh, thanks, Jody. Yeah, just a quick question. I've read this, but I thought since I've got an expert right here in front of me, after a COVID infection, what is the recommendation for a booster? If you didn't get I have a 15-year-old who unfortunately got sick the day they approved the booster for 15-year-old. So he's fine now, but what's the wait time?
Yeah, so there isn't really a specific wait time so long as you have completed your quarantine period. So if he got sick, it would probably be about 10 days after that initial test, as long as everything's improving. Mostly that's really that we don't want him to still be infectious to others at the time he would go to get a booster. He probably has some additional protection from that infection up to 90 days. So it wouldn't be something you would need to necessarily run out and get right away as soon as he's feeling better. And you could potentially extend out the effectiveness of that booster by waiting a little bit. But there's no specific recommendation other than making sure that you've completed that quarantine period.
Okay, great. Thank you.
Yeah.
And then I think we've got time for one last question from Christina in the chat, and thanking you've had a couple thankful comments about the great information, but do the N95s or other masks lose their efficacy over time?
The answer is yes. Anytime that we reuse the same material, we are potentially degrading the quality of that material. We have moisture in our breath. Oftentimes the N95s have straps that wear out over time, and so they create a looser fit around your face. In general, if you are reusing N95s, we recommend that you use one per day. Take it off, store it in a paper bag, let it sit for several days, and then you can reuse it. That allows it to dry out completely. And then if you're noticing that the straps are loose and you're not getting a good tight seal, toss it and use a new one. Also, if something becomes wet, it's less effective at filtration, or if things are damaged as well. So we don't recommend you store it in paper because it does, or sorry, you don't recommend we store it in plastic because it doesn't give that same level of airflow that allows the mask to dry completely.
Thank you so much, Erica. I can't express how helpful this is. This is really highly technical information that you are able to present in a really, really bite-sized, digestible way, and that is a skill. So thank you so much. I also know how incredibly busy you all over there. So just you taking the time to come and share with us and have this recorded for other folks to access it later in their staff is just wonderful. So thank you so much. I really appreciate it. I will connect with both you and Idabel after the fact to make sure we get lots of information out to folks. So thank you.
Wonderful. Thanks for the opportunity. Really appreciate everyone's time and attention.
Thank
and
you.
Seriously, everything that you're doing to keep people safe in your personal lives and your work lives, it's a lot right now. So much appreciated.
Wise words. Thank you, Erica. We are doing fantastic on time, folks. I'm like really pleased with us. I'm going to hand it over to my colleague, Sarah, to introduce our next presenter and guest.
Great. Thank you, Jody. And thank you so much, Erica. That was really, really helpful. And having kids at home, it's so important to get those kid size masks. Maybe we could also coordinate with the school districts as well and get them to kids that way too. So I am introducing our next speaker, Karen Pilar from Team Child. She is the Director of Policy and Advocacy. Team Child is a fabulous civil legal aid organization that provides legal services to youth around issues around education rights and the intersection of our criminal justice system and our education system. Unfortunately, there is an intersection there that Team Child is working to eliminate. And she's going to talk to us about a new law that is going into effect around youth and Miranda rights. So thank you for being with us, Karen.
Good morning, everyone. Thank you, Sarah, and everyone coordinating your gathering today. Thanks for being here, everyone, and for the work you're doing. My role at Team Child as the Director of Policy and Advocacy is pretty new. So my hope in the next year or two is that we'll have more conversations, not just about bills that passed, but also about problems and issues you and your communities are seeing and ways we can propose bills and changes that will improve things for the future. The bill the law that's coming into effect now that I wanted to talk about kind of came from that kind of just advocacy and coalition building. It actually started in King County with advocates in juvenile court and young people who have been involved in juvenile court, seeing and feeling the frustration that most of the time when young people are interacting with the police, irregardless of whether they're read their Miranda rights or not, they tend to speak to the police in ways that don't help them in the long term in regards to protecting their rights and not self-incriminating. And as like attorneys who represent youth in juvenile court often see confessions and admissions that maybe folks who are a little more savvy wouldn't necessarily make or do. And you know, the relationship that happens when a young person, relationship's not the right word, but the interaction between a young person and a police officer and any person, quite frankly, is really fraught. And it's really hard sometimes to understand the rules because there aren't a lot, right? Police can sometimes say dishonest things and that's okay, make promises that they don't have to keep. And so there's a lot of power imbalance. So people just can see and have sort of known that the concept that you have this very strong federal constitutional right against self-incrimination isn't easy for a young person to hold on to and make manifest, right? Like and have that happen in the moment when you are interacting with a police officer. And their advocacy that happened in King County got a local ordinance passed that then they've successfully sort of turned into a statewide law. And so the way the rule works is that when a police officer encounters a young person in the community that they might be thinking about arresting or even just interrogating, they have to read the Miranda rights, but they're not allowed, there's one more step besides reading the Miranda rights. And we've actually even passed some laws that made the Miranda language more straightforward when you're reading it to young people, but they actually are required, the police are required to get in phone contact with a lawyer and facilitate that young person speaking to the lawyer. And then the lawyer advising the police officer, like informing the police officer how or whether an interrogation will go down in that moment, like wherever they are in that moment. And the mechanics of the law have created a pool of attorneys who are on contract with the state to be available 24 hours a day, 7 days a week. There's a fairly large pool. I feel like they hired like 60 to 80 attorneys at some sort of rate where there are multiple attorneys available for like a week or 2 week period of time. They kind of rotate throughout the year to be able to take these calls from the hotline so that any police officer anywhere in the state is interacting with a young person and needs to have that contact with the attorney. They call this hotline, that an attorney is connected with the young person. And then that attorney's job is to advise the young person of their rights, to help them understand what they don't have to say, what they're allowed to do and what they're not allowed to do in regards to this interaction with the police officer, so that the young person is more informed about whether they need to speak at all, and to what degree, if they need to say anything. That's the essence of this new law that starts to go into effect next week, I guess, or at the end of this week. I know the contracts went out with the attorneys, the proposal for people to apply. I don't know who a lot of the attorneys are. My guess is a lot of public defenders will take this on as like an extra task, but there's requirements and opportunities for interpretation if needed for the young person, if they need to have an interpreter in order to speak with the attorney. That's been contemplated. The phone call between the attorney and the young person cannot be recorded, and it must be private. I'm just going to say this is what the law says, but there's a lot of practical questions about how this is really going to play itself out. The onus is on the police to make that call, to get that, and if they don't do it, anything that happens in that interaction is going to not be something they can use, in a court of law. So the age range, it's really all youth. There's really not, under the age of 18, I think is what is still considered youth for this bill. So, if it's rare for police to interview and interact with someone very, very young in the anticipation of sort of an arrest, but there's not a bottom age limit for the expectation. Let's see. So like the conversation between the young person and the attorney has to be like sufficiently out of range so that the police can't hear the conversation. And then the police officer has to speak to the attorney again before communicating with the young person so that the attorney can explain to the police officer what the plan is. So it's not the young person's then jobs to sort of get the info from the attorney and then articulate it to the police officer, like, oh, this is what I'm going to say and not say, but the attorney explains it to the police officer sort of as the represented, attorney for the client, right? Like as an attorney, I could say that's not unusual for an attorney to like sort of be the person who articulates the rules. We do that in court, right? For our clients, explaining to the judge, what we will and won't do. And so all that has to happen before a young person can waive any constitutional right. So before they can agree to answer questions or make an admission or something like that. It's the sort of legal terms when this comes up is what they call a custodial interrogation. So a police officer is questioning you and you're not free to leave. This is one of the things that's so complicated about being in the presence of police. If a police officer sort of stops you on the sidewalk and chats with you, are you in custodial interrogation? Well, if you're 13, are you feeling free to be like, hey, don't feel like chatting, see you later, bye, and walk away? Or are you detained, right? Are you not allowed to leave? That's a pretty unclear mark. In our work, the place that we see it most unclear is you've been brought into the principal's office. When a police officer or SRO comes into the principal's office, are you free to leave? That's tricky. But are you in custody of that police officer? I mean, they'd all probably say, no, you're just sitting in the principal's office. So there's so much grayness in how young people and police interact. So these are some questions we'll be having kind of going forward is, are these calls going to happen when you're sitting in the principal's office and the SRO is coming in to ask you questions? I would hope yes. So it arises during what's called a custodial interrogation. It arises if a young person is detained by the police, held by the police because the police feel like they have probable cause that the young person's involved with the crime. So that's essentially like at a level of arrest. It's required if the police want the juvenile to consent to a search. So these are all constitutional protected rights, right? Like you're protected from having to admit that you've done something. You're protected from unwanted searches of your body or your possessions. And at these moments, when you have a protection, you're supposed to have access to an attorney before you give up those protections. Let's see, some questions people have in the chat. Community accountability, public oversight. That's a good question. I don't see in the bill clarity about exactly how oversight is going to play itself out, because some of that is going to depend on young people saying, right, that they got or didn't get access to that attorney. Yeah, so I think that's a really an unanswered question. I'm not sure how they're going to make sure that it's done and happening. Like I said, there are these rules in court, in criminal court, like if you're going to present evidence in a criminal case, the evidence had to be obtained in a legal way, right? So the check, one check on this sort of power check is that, if a cop interviews a kid and they say something, the prosecutor can't be like, oh, there's the admission. They can't come and use it in court and say, look, the kid admitted, if that dialogue happened and these protections weren't in place, right? They didn't have access to that attorney. So the suppression of evidence or the ability to not, admit evidence against the client, in a criminal case is a protection, because if they want to prove the kid is guilty, they're going to want to get the evidence in a way that can be used in court. But that's got like a lot of steps along the way, right, to get to a place of true accountability. And one theory that I've heard is that it's probably just going to change police practice in some ways that we can anticipate, and maybe in some ways we can't anticipate. We're going to need to watch. The one that we anticipate is that it's likely that police are not going to try to detain young people in the moment. They're just going to let them go because they don't want to take the time to wait, call this 1-800 number, get connected to an attorney, give the kid an attorney. Like, police are busy. If it's not a serious enough situation in the police officer's mind, they might just wait. Maybe they'll go back and try to interview or interrogate the kid later, go do other investigation on the crime, and then go get the kid to detain them or arrest them. Like it could change that kind of thing, how the police kind of conduct an investigation of a case, where often they might in that moment, latch onto a kid and ask a lot of questions. Is that likely to happen in a very serious situation? I'm probably not going to let the kid go in those moments. So, there's but if that happens, if that one theory happens, if they just don't hold on to kids in lower level issues, perhaps that's a benefit for young people and advocates for them, in that it gives young people the chance to reconnect with the people that support them, and then have that support to now, you know, if the cops come later to say, hey, you need to come down to the station, we need to interview about this shoplifting issue, or, you know, something related to potential crime. It slows things down, and maybe that makes it possible for that young person to get some more support and sort of enter that process more thoughtfully. There are 2 exceptions to the law, just for what it's worth. That one may be more specific, other maybe more discretionary, but they don't have to make this attorney access call if they believe the young person is a victim of trafficking. But they can't use information they might get in an interaction with that person to prosecute them in anything related to trafficking, or really, I guess, any prosecution. So I think there's some theory, and I don't know really in reality how true this is, but some theory that there are moments when the police do detain someone that they have a concern is trafficked, and use the tool of detaining them as a way to help. You know, not that long ago, those young people would also then be prosecuted for prostitution or something ridiculous. We are generally doing less of that in the state of Washington, but it's still pretty traumatic to be arrested and like brought away from a situation, police car and things like that. But that is one exception. And then the other is if the police officer believes the information that they're seeking is necessary to protect the individual's life from imminent threat. So again, not totally sure. In my mind, that is a situation where a police officer encounters someone in a moment of attempting suicide or something, right? Like that they're going to talk to them, they're going to ask them questions, they're going to engage with them in the attempt to, you know, literally talk them down from a moment of, you know, attempted suicide. Something like that is what makes sense to me when I read that language, but I don't really know in practice what that's going to look like. All right, thank you. Yep, my time is up. So thanks so much for giving me the time to give you that intro, and happy to also talk to young people about it if you have places where they're gathering and they want to discuss it more. So I really appreciate the time today.
Thank you so much, Karen. This definitely seems like a step in the right direction, and I'm interested to hear, you know, how this plays out in practice. I am going to move us to our next agenda item, which is a little bit of some updates on the legislative session. Allison, do you want to start us off, or do you want me to jump right in?
I'm going to start us off by saying we have a bill.
So you are all hearing it here first. We literally just got our bill number, which is House Bill 2075. And this is the coalition's very first bill around DSHS customer service. I'm going to pull up I had it here. Where did I put it? So House Bill 2075, establishing service requirements for the Department of Social and Health Services. So this bill will set minimum standards for customer service, both in the DSHS offices and on the call center. In very practical terms, it will require, if it passes, it will require DSHS to have their doors fully open for anyone to walk into an office and get assistance. It will also require that the DSHS call center has a wait time of less than 30 minutes. We know that people during the pandemic and before, you know, can wait on hold at the call center for, we have heard over 3 hours, but 2 to 3 hours is not uncommon. And this bill would require that wait time to be less than 30 minutes. The department will have to show through data that that's happening, and there will be oversight from the state auditor on a regular basis, reviewing the data to ensure that those numbers are met. So we will, our sponsor is Representative Strom Peterson. We would love to have more than one sponsor. As Allison put in the chat, it's great to contact your lawmakers and ask them to support and potentially sponsor this bill. I will also be sending out, now that we have, I've just been waiting on our bill number to get our first action alert of the legislative session out to all of you to take action and send your lawmakers a message that says, this is important. We need to be the people, especially you that are working on the front lines, and you are probably yourselves potentially sitting on hold for 2 and 3 hours with DSHS helping your clients, or hearing your clients are coming to you saying, I can't walk into DSHS, I need help. They need to hear from you that this is an important bill. This is important for vital safety net programs that people need to be able to access. So that will be going out today. I hope that I can count on each of you to click on that action alert. And also, you know, as we move into legislative session, you know, set a goal for yourself of how many times per week you can commit to taking action, not just on our bill, but on a lot of important issues. I try to, you know, I don't have a specific goal, but I try and click on all of the ones that come across my email every week, which is a fair amount, and lend my support and tell my lawmakers the things that are important to me. So that's where we are, 2075. It's exciting. Allison?
Muted myself and I had to unmute. Okay, so thank you so much, Sarah. It's hard to describe how thrilled we are to have this opportunity. And I have to stress, it is an opportunity to explain to lawmakers what it means for people on the ground. The DSHS offices closed their doors on March 13th, 2020. And they did not open even partially until November 2021. And they are still not fully accessible, as Sarah just explained. But most people who hold elected office in virtual Olympia don't know that. And they don't know how enormous the effects of that are on people experiencing homelessness and on many other people. And it's our job to make sure that they understand that. I have to say, this is our opportunity. And each of you here really does have the obligation, I would say, to make your voices heard, but also to help your coworkers, your clients, the residents where you work, your board members and others speak up on this issue. There are also a number of other really exciting bills that we want to invite you to support. And just as a quick reminder for those who might not track this, because we know you're all really busy for the most part doing other kinds of very, very important work, and you can't track the legislative session, this is a short session. It is a 60-day legislative session, and today is day 10, which means that between now and our February general membership meeting, lots of bills will die. They simply will not move forward in the process. And we need to speak up on the ones that we care about, including an anti-rent gouging bill that we think is going to be dropped today, including a bill that's already been introduced that's going to help ensure that if there are rent increases of 3% or more, there is advance notice, 6 months notice given to tenants, including really important legislation to help restore TANF benefits to pre-2008 recession standards. And of course, huge efforts that we are supporting to create additional homes and to dedicate $500 million of currently unallocated ARPA money for affordable housing for people who need permanent supportive housing. So Take Action Tuesdays. Yes, thank you so much, Jody. We are really trying to make this very easy for you. And we have a 1 p.m. 45-minute session on Tuesdays. You can sign up on our website, and really we encourage just one person per organization to show up if you can and bring the information back. One of the things we were just reflecting on as a staff is that we actually haven't seen as many action alert links come out as we might expect, but it's because there's been so much work coming before the session and in the first 10 days of session, but you can expect to see more action alert links from us and from our friends and partners at Poverty Action, at the Housing Alliance. And what we really encourage you to do, as Sarah said, is click on all of them. It is super easy, but I think I'm going to ask Sarah or Jody to bring up the general message from the Housing Alliance that they sent out, just asking lawmakers to support many of the very excellent investments in housing and homelessness that were proposed in the governor's budget, as well as some specific recommendations that the Housing Alliance and we are supporting. And it's a great opportunity, if you haven't yet sent an email to your lawmakers, to introduce yourself to them. Treat it as a virtual opportunity to just stick your hand out, introduce yourself, say what kind of work you do, where you do it. Remember to say that you're a constituent and a registered voter, and give yourself the opportunity to be one of the people whom they then flag as someone who has expertise on issues that are coming before them. So we will be sending additional information out about a number of the bills that we've touched on, as well as other bills that are coming up. But the big takeaway today, and I think I might just even ask everyone to please turn your cameras on if you can, so that we're not just spending the last 3 minutes looking at each other's black boxes and names, but that we're looking at each other's faces. Thank you so much, everybody. What we're asking you to do is to ask your state representatives today, before 2 p.m. tomorrow, to co-sponsor House Bill 2075. Because right now, Representative Strom Peterson might think that he's, doing something good, but it may or may not move forward. But if his office starts getting pings from other state representatives saying, I'm hearing from my constituents that you just dropped this bill that they are really passionate about, then he is going to, be more excited about this and some other really good bills that are coming before his committee. We have really just a few days. Before 2 p.m. tomorrow is the deadline for signing on as co-sponsors. And then really within the next week, we're expecting that this bill is going to get a hearing. And so you bet we'll be asking you to sign in, send emails, sign up to testify if you or the folks you work with might be interested in doing that. And obviously we're very excited about this bill, but quite frankly, fixing state benefits programs is just the tip of the iceberg, right? So we all know that there's an awful lot of other communication that we need to do. And just as a little reminder, we are a small and mighty coalition. The folks who the lawmakers hear from day in, day out are the paid corporate lobbyists. So every time you raise your voice or make it possible for folks in a staff meeting or a house meeting or a congregation that you're part of to raise their voices up, is another opportunity for us to remind lawmakers that there are other really important perspectives and voices that they need to be listening to. And we'll do everything we can to make it easy. So I'm going to stop talking and turn it back to Sarah and Jody. But I have to hold this sign up because it just delights me.
Go for it, Jody.
I mean, I think we're right at 10:30, but certainly we are happy to hang out for a bit if folks have a few questions or final comments. I just threw the link to our February meeting into the chat, and I will be working